There are multiple reasons why I'm so passionate about education and research. I really looked up to some of the cardiologists who educated me as I was going through med school and as a junior doctor. And so because of that, I feel that I can try and hopefully affect other junior doctors' lives and provide sort of some training and mentorship in the area of cardiology. So on top of being a cardiologist with Monash Health, I've gone into the subspecialty of electrophysiology. And so what that means is patients who need pacemakers, patients who have funny rhythm problems, so palpitations or the heart racing, we do procedures to try and improve symptoms for these patients. The other side of things includes my work with Monash University in an academic role, and so that's a combination of both research and education. And so from an education perspective, we've over the last 12 months looked to put together an education portfolio related to cardiac or cardiology education. We created a GP masterclass course for GPs around Australia. We're hoping that we can sort of educate the broader medical team in terms of caring for patients with cardiac issues. We were able to reach GPs in rural communities who generally lack access to these kinds of education courses. I think the biggest benefit of the Victorian Heart Institute being co-located with the Victorian Heart Hospital is that there's really an amalgamation of people and minds under the one roof. You know, if you look at how the hospital is, there's clinical floors, there's academic floors where research and education happens, and everyone basically shares the same space. Everyone shares the same ecosystem really when it comes to the work environment. I really have the opportunity to tap into all these resources that I never had before. Sometimes I think of myself as a clinician, as a researcher, as an educator. I wear sort of these different hats, but it's almost sort of wearing one big hat all at the same time now. For all the students out there thinking of coming to the VHI, there's great opportunities to learn. And so that's learning about clinical cardiology, but then also potentially learning about how to do research or how to get involved in clinical trials. We're really looking to create the cardiac workforce of the future, providing cardiac care to the community, and how we're doing that is really through the education portfolio that we're creating through Monash University.